Okay, this is risperidone. Um, it's sold under the trade name Risperdal. It's also in with Quanapine and Seroquel. These are atypical antipsychotic and mood stabilizers. These are used in like schizophrenia spectrum disorders. It can be for not negative or positive symptoms. So psychotic episodes induced by levodopa therapy as well, and the relief of psychotic manifestations and other disorders such as bipolar disorders. The the contraindications are all atypical antipsychotic medications can cause death related to a cerebral vascular accident. So do not administer with other atypical antipsychotics. Do not drink alcohol. And then you're going to certainly use cautiously with clients who have cardiovascular or cerebral vascular disease, or if they have seizures, or if they have diabetes mellitus. Okay. So some adverse effects would be glucose control and weight gain. Also, some anti-cholerogenic effects. You wouldn't want to give this for a person that has cataracts. These can also cause agitation, dizziness, sedation, and sleep disturbances. And then these have a low risk of extra pyramidal symptoms. We're also going to do patient education and focus on recognizing and reporting signs and symptoms as well. So the extrapyramidal symptoms, which is EPS for short, it causes acute dystonia, which are severe spasms of the tongue, neck, face, or back. So this medication has a low risk for these, but it still can occur. Akaphasia, which is the inability to stand or sit still. It can cause continually pacing and an agitative state. It can also cause tardive dyskinesia, which are involuntary movements of the tongue, face, such as lip smacking, things like that. Can also cause some Parkinsonianism, which can be like bradykinesia, rigidity, shuffling of the gait, drooling, and tremors. Some patient education that you would want to do would be clients should have a screening eye examination, and then every 6 months after that to make sure that they have not developed cataracts. Explain to the clients that they will receive low doses initially and then gradual increases. And then also the cost of antipsychotic medications can be a factor for some clients. So evaluate the need for a case management intervention. Instruct clients to report indications of diabetes like increased thirst, urination, and appetite, and then advise clients to follow a healthy, low-calorie diet and engage in regular exercise and monitor for weight gain. You would instruct the clients to change positions slowly, and then inform the clients about measures to relieve dry mouth, such as sipping on fluids. Also, chewing some sugarless gum will help to moisten that inside of that mouth as well. Some nursing considerations would be to obtain a baseline fasting blood glucose and monitor throughout the treatment. Monitor cholesterol, triglycerides, and blood glucose for any significant weight gain. You're going to monitor blood pressure and heart rate for orthostatic changes. Monitor for anti-cholerogenic effects and report occurrences to the provider. And monitor for agitation, dizziness, sedation, and sleep disruption and report to the provider if they occur. And monitor and report for EPS effects.